Hi, everyone. I'm Sarah Seibert, Managing Editor of CIO Media and Research, and joining me today is Konya, the Chief of Innovation and Strategic Partnerships at ASTP with HHS. Thank you so much for joining me today.
Thanks for having me.
Yeah, so we're tuning in from the Health IT Summit, and we just had our Flywheel Awards. Spoiler, Stefan is one of our winners. So I wanted to dive a bit deeper into the initiatives that you've been working on. So you've been credited with catalyzing innovation or initiatives like CancerX that directly impacted patients' lives in sometimes urgent or life or death circumstances. So how do you approach building innovation ecosystems that stay deeply rooted in patient needs while also advancing cutting-edge tech?
That's a pretty broad question, and I don't think there's a succinct, direct answer to it. Over the past 20 years, I've worked in both state government and federal government, and the one thing that's been part of my DNA from the beginning is the power of innovation ecosystems. In fact, there's a great report that was issued, or easy kind of white paper that was issued under the National Science Foundation back in 2010. That's kind of been my professional Bible, and it's about the science of innovation ecosystem building. And Deborah Jackson is the author of that. But it maps kind of like a scientific biological system to an innovation ecosystem, not specific to healthcare, but it's just in general. How do you build the right conditions for all the different living and non-living assets within a region or an organization to be able to then work together and catalyze more innovation? And recognizing that government is absolutely one of those actors, right, alongside all the rest of them, whether they be startups or investors or local governments or not-for-profits, academic institutions, you name it, private sector. And then figuring out how do you get them all to work together in perfect harmony and create the conditions for that is something that government is uniquely positioned to do, right? So it could start with setting the table and creating the opportunity for all these stakeholders to come together. At its minimum, government, and for no cost or very little cost, can be a convener, right? And just get all the right people and interested parties to come to the same table and figure out what is the menu that they want to create for that opportunity. What are the things they need to try to tackle? Where are their common shared, pain points? And then from there, it's amazing what you see what happens. Maybe not everybody at that table joins in, but usually you get at least half or a good number of them, and then that catalyzes something, and then others, grow onto that.
So what are some of the biggest barriers to patients today, and how can innovation leaders continue to break down those barriers?
It's listening about where there is pain points from those. And a lot of times you can get it through advocacy groups and others. Working with patient advocates is a great opportunity to kind of get their voice represented. But then taking that back internally and thinking through on a policy perspective, what can we do to address some of these issues and ensure that interoperability framework is there and the data is available to help them be leveraged. And then outside of that, what are the specific public-private partnerships that can bring together technologists, developers, investors, everyone else that can get more of those built for purpose solutions into the marketplace faster?
Right. That makes sense. So speaking of building those connections, you've led national programs like the Federal Innovation Days and interagency collaborations that bring together those leaders into a direct conversation. So what are some of the lessons that you've learned about translating federal innovation into real world patient and provider impact?
Translating. Okay. Mm-hmm. So a couple of things. One is while it's of course important to try to figure out everybody outside of government that needs to be invited to that table.
Right.
You can't lose sight of the fact that you also need to invite everybody inside of government to be at that table. So we can be better coordinated and informed and provide more services to the public in a more unified manner, right? So our colleagues at CMS or FDA or CDC or HRSA or VA, doesn't matter. If there's an issue that kind of impacts or has a potential to benefit the work that they're doing, always making sure that we're bringing them into these large scale initiatives as well. And, having them have a seat at that table and because they're the subject matter experts in those various areas, and then figuring out how can we launch something ultimately that's going to benefit their constituents and the communities that they work with as well. That's how you get to things at scale.
Right.
So we're always, trying to make sure our colleagues are there. And as far as the translation of it, you referenced Federal Health Innovation Days. That was a program that we launched actually under the first Trump administration. The CTO at the time, Bruce Greenstein, the first CTO, wanted to get out there and meet innovators where they were, startups and investors and others, and wanted to know how can we have very low budget, but how can we meet them where they are not expect them to come to DC and hire a lobbyist because they don't have those resources, but how can we make sure that they're aware of policy that may impact them, or ideally get their voice made in the policymaking process? How can we make sure they're aware of funding opportunities, or, helping them just navigate the different agencies that exist, right? And so we came up with an initiative, at the time it was called HHS Startup Days, and we went to like 18 cities and brought multiple agencies with us and created an opportunity where they were kind of reverse pitching. Each agency had 10 to 15 minutes to say, here's what makes my agency unique compared to other agencies. Here's how I believe I support innovation. And then here's how you can work with us. And then we would work with local community organizations, these different cities, often an incubator, an accelerator, or a healthcare counselor or someone. And they would roll out the red carpet, and they would have the innovation community come out that often included patients and others, or academic researchers, private sector companies, whatever it may be. And you'd have this dialogue between government and the innovation community at a local regional level. It was extremely insightful for both sides, right? And so we're helping them navigate government, but we're also understanding where there are pain points and friction in the marketplace, or a lack of clarity of the different agencies and what kinds of resources we have available to support them. And that helps us then go back and figure out, okay, there's better ways that we can be getting this information out there.
Right, that makes sense. And I'm going to throw a pun in there. So Flywheel Awards,
yes.
The Flywheel, how are you keeping this momentum going, or what's next on the horizon for you?
Yeah, so and again, I've said this before, some people have heard me say it, but there's nothing in my career that I've done that I'm proud of, that I've done by myself. Everything that I'm proud of that I feel like had impact or value was done by working with and alongside a number of other stakeholders, right? And so it's through those partnerships, whether it's multi-agency partnership or whether it's, with external stakeholders, that's where the impact gets real, and that's where things get sustained, right? So when we think about any government program that we launch, I think we have a responsibility to think about, number one, the fact that we are lucky to be able to be empowered to pursue that at that given time, because you don't always get the green light to do something like that. And then when you do, you got to take advantage of it. And the clock's ticking often. And then once you do that, to think through, if I'm not here tomorrow, or if the funding dries up, if there is funding involved, how can I design this in a way where it can outlive my involvement, right? And it can be sustainable beyond that. So there should always be like a seat reserved at that table for government to be involved in it, because we help launch it and create the conditions. But, as priorities change over time, as funding changes over time, like, in government, you never want to be too dependent on something, into perpetuity. So designing the idea of like, what's the exit strategy for government should we have to, right? And then how does that collaborative or that initiative, that partnership live and thrive on without government, or even if government's just paused for a while, whatever it may be, so that way that the work can continue and be sustained. The other thing I'll just mention quickly is, in 2017-ish, we came up with an idea of like how to launch these public-private partnerships under the American Competes Act. So we've been doing prize challenge competitions and other things, which are a form of public-private partnerships. But then these large-scale calls to actions around different needs. CancerX was the first one that we launched, and we're still doing that today. And in fact, Congress got behind it and put some funding into it from the government side. But it's advanced a ton of innovation in the space of nephrology and kidney care. And we do it in partnership with the American Society for Nephrology and other organizations. LymeX came shortly after that, and that's still around today as well. And then we went on to do Pandemic X during the pandemic. It was a 1-year program. It's no longer around. And then we helped launch KidsX and CancerX, which neither got funding from the federal government. It was more the coordination aspect. But every one of those, there's a little bit of a methodology to how to get them organized and launched. Each one of them is different and unique. But the overall approach for that, we call Innovation X. And then the idea is that can be used to launch the next thing that's a big priority, So under this administration, if there's something that they really want to rally the innovation community around and have government work alongside them to try to advance innovation in that space, we've got a methodology for how to do that. And it's just a matter of determining what those priorities are. And then we put out the call to action, and then it's able to kind of get executed. And hopefully, again, we, kick the baby bird out of the nest, let it fly, and move on to the next one.
Yeah. That's awesome. So I know that you mentioned Innovation X, but as like a final closing question, are there certain programs or partnerships or collaborations that you're most excited about? Not to bring favoritism into it. but
Yeah,
anything on the horizon?
Anything, I can't get specific, but anything that's multi-agency initially, and then we were able to really get out there and cast a wide net and bring in industry on it is what excites me. Just getting all the right people in the room. It's the old 3 C's. I don't know if you've ever heard the terminology in the innovation circles, but convene, collaborate, and catalyze. And so the idea is, just get people in the same room. That's step one. And sometimes that's good enough to get people going. Give them something to collaborate around, a topic of focus, find common ground through that. And then hopefully that leads to then catalyzing, actually doing something and making impact and getting actually something launched out of it. And so, that's the part that I love the most, is that early kind of forming of like, where is there opportunity? But like I said earlier, not starting with the question of, can we do this, but always starting with, okay, how can we do this? Right. And assuming that there is a way, we just got to figure out a creative way to do it legally within the law, in a way that's fair and open and transparent. But it's those kinds of things that excite me the most in general. There's a lot of areas, I work at ASTP, the Assistant Secretary for Technology Policy. So I'm all about interoperability and data and so on. And so on that side of it, the great thing about these public-private partnerships is, selfishly for me, we're always trying to figure out how can we leverage these efforts to then kind of be like, a backdoor way to sneak in some of our data standards work or, whatever. So like with CancerX, we launched US CDI Plus for Cancer at the same time. We had a great engaged community that we could educate about it as it was being built, launched, get it validated from that community and so on. So it's always valuable when you can kind of get, two first, right, and achieve something else with it. But I'm excited about emerging tech areas like digital twins. I still think we need to do some more work around e-consent. It's just more in the technical weeds area, but it supports so many different aspects of healthcare innovation and interoperability. Clinical trials infrastructure, we've been doing a lot of great work on that with industry. So there's another number of topics, and I'm always excited for kind of what's next.
Yeah, me too. And thank you for the work that you're doing. I'm excited to see where these different initiatives go, and hopefully we can connect in the future. Okay. Congratulations on the award.
Thank you so much. Appreciate it.